7 warning signs of poor brain circulation. Your brain needs more steady, uninterrupted blood flow than almost any other part of your body, and when that flow slows down even slightly, it rarely shows up where you'd expect. Not in your legs, not in your hands. It shows up in ways most people spend years explaining away, mistaking them for nothing more than getting a little older. This video is for educational purposes only and is not intended to diagnose any condition or replace the guidance of a qualified healthcare professional. If any of what you hear today sounds a little too familiar, it is worth bringing up with a doctor, and if something feels sudden or severe, it is worth seeking care right away. Here is something most people never learn until much later in life. Your brain cannot store extra fuel for the moments ahead. It depends on a fresh supply arriving through your bloodstream every single moment, whether you are awake, asleep, resting, or moving. So when that supply becomes even a little inconsistent, the earliest signs tend to be small, quiet, easy to blame on a rough night's sleep, a busy week, or simply age catching up. Stay with us because one of the 7 signs we are about to cover is the one people live with the longest before anyone, including their own doctor, ever connects it back to their brain. We will get there. But let's start with the one that tends to show up first, often before anything else does. Number 1, frequent dizziness or a feeling of being off balance. Occasional dizziness happens to almost everyone. Standing up too fast, skipping a meal, or feeling a little dehydrated can all cause a brief spinning sensation that passes within seconds. But when dizziness becomes a frequent visitor, showing up several times a week or even daily, it may be worth paying closer attention to. The brain relies on a constant, steady stream of oxygen-rich blood to keep its balance centers functioning properly. And when that flow becomes inconsistent, the result can feel like the room is tilting, swaying, or spinning, even when nothing around you has actually moved. This kind of dizziness is sometimes described by patients as a sensation of being slightly detached from their surroundings, as though they are walking on a boat rather than solid ground. It may come and go throughout the day, often becoming more noticeable when changing positions, such as standing up from a chair or turning the head quickly. In some cases, it may be accompanied by a brief moment of lightheadedness or a feeling that a fall could happen, even if it does not. Consider Margaret, a 71-year-old retired schoolteacher who began noticing that she felt unsteady almost every time she got out of bed in the morning. At first, she assumed it was simply a normal part of getting older. She started holding onto furniture as she walked from room to room, something she had never needed to do before. It was not until her daughter mentioned that this had been happening for several months that Margaret decided to bring it up with her doctor. Stories like this are common because dizziness tends to be dismissed as a minor inconvenience rather than a signal worth investigating. It is important to understand that dizziness has many possible causes, ranging from inner ear issues to medication side effects to blood pressure changes, and it does not automatically mean that circulation to the brain is reduced. However, because dizziness can be associated with reduced blood flow, it may be helpful to mention any frequent or unexplained episodes to a healthcare professional, particularly if the dizziness is new, worsening, or occurring alongside any of the other signs we will cover in this video. There is also a version of this sign that shows up specifically during physical exertion. Some people notice that climbing a flight of stairs or bending down to tie their shoes brings on a brief wave of lightheadedness that passes once they slow down or sit for a moment. Because it resolves quickly, it is tempting to think of it as nothing more than being a little out of shape. Yet this pattern, appearing consistently during exertion or position changes, is exactly the kind of detail worth mentioning at a routine checkup, since doctors often rely on these small, repeated patterns to understand what might be happening beneath the surface. Number 2, sudden confusion or trouble concentrating. There is a difference between the ordinary mental fog that comes from a poor night's sleep and a sudden, noticeable difficulty in thinking clearly. When the brain does not receive enough blood flow, even temporarily, it can struggle to process information at its usual speed. This may show up as trouble following a conversation, difficulty remembering why you walked into a room, or a strange sense that your thoughts are moving through fog rather than flowing naturally. What makes this sign particularly important to understand is how easily it can be brushed aside. Many people, especially those who are still working or managing a busy household, attribute this kind of confusion to stress, overwork, or simply having too much on their mind. And in many cases, that explanation is accurate. But when confusion appears suddenly without an obvious cause, or when it comes and goes in a way that feels unfamiliar, it may be associated with changes in how well blood is reaching certain areas of the brain. Some individuals describe this experience as briefly forgetting a familiar word in the middle of a sentence, or momentarily losing track of what they were about to say. Others notice that simple tasks, like calculating a tip at a restaurant or remembering a short grocery list, suddenly feel more effortful than they used to. These moments are often brief, lasting only a few minutes, which is part of why they can be so easy to overlook or explain away. If confusion appears suddenly and is severe, or if it is accompanied by any of the other signs discussed in this video, this could be a medical emergency and immediate attention should be sought. For milder or gradual changes in concentration, it may be helpful to keep a simple note of when these episodes happen and discuss the pattern with a healthcare provider, since tracking frequency and triggers can offer valuable information during a medical evaluation. Family members are often the first to notice this sign, sometimes long before the person experiencing it does. A husband might notice his wife repeating a question she had already asked minutes earlier, or a coworker might comment on a colleague, seeming unusually distracted during a meeting they would normally lead with ease. These small observations, easy to brush off in the moment, can carry real value when shared. If someone close to you seems noticeably foggier than usual, gently mentioning it can sometimes be the nudge that leads to an important conversation with a doctor. Number 3, numbness or weakness on one side of the body. This is one of the more widely recognized signs associated with reduced blood flow to the brain, and for good reason. When circulation to a particular region of the brain becomes restricted, it can affect the nerve signals responsible for movement and sensation on the opposite side of the body. This often shows up as a tingling, heavy, or numb feeling in the face, arm, or leg, and it typically affects only one side. Some people describe this sensation as their arm suddenly feeling like it does not quite belong to them, or as though it has fallen asleep without any obvious reason, such as sitting in an awkward position. Others notice that one side of their face feels slightly droopy, or that they have difficulty gripping objects with one hand that they had no trouble holding just moments earlier. In some situations, this can also cause a subtle change in the corner of the mouth or eyelid on one side. James, a 64-year-old retired mechanic, first noticed something felt wrong while pouring his morning coffee. His right hand felt strangely weak and the mug slipped slightly before he caught it. He assumed he had simply slept on his arm the wrong way. It was not until his wife noticed a slight change in the way one side of his face looked that they decided to seek medical attention that same day. This kind of story is shared often in medical settings because early symptoms can feel minor, even when they are not. Sudden numbness or weakness on one side of the body, especially when it appears without warning, is widely recognized as a symptom that may require emergency evaluation, since it can be associated with a stroke. If you or someone near you experiences this suddenly, it is strongly recommended to call 911 or seek emergency medical care immediately rather than waiting to see if the symptom passes on its own. Medical professionals often teach a simple method to help recognize this sign quickly in the moment. Checking whether one side of the face droops when smiling, whether one arm drifts downward when both arms are raised, and whether speech sounds strange or slurred can help identify a possible emergency within seconds. Remembering the exact time symptoms first appeared is also valuable information, since it helps guide the decisions medical teams make when a person arrives for care. Even if the symptoms fade before help arrives, that information should still be shared, because brief episodes of this kind can sometimes be an early warning of a more serious event to come. Number 4, sudden vision changes. Vision depends on a remarkably delicate network of blood vessels, and even brief interruptions in blood flow can affect how clearly a person sees the world around them. This can appear as blurred vision in one or both eyes, temporary double vision, or a sudden loss of vision that may last anywhere from a few seconds to several minutes. Some people describe it as a curtain briefly falling over part of their field of view, while others notice that straight lines suddenly appear wavy or distorted. Because vision changes can also result from many other causes, including eye strain, migraines, or underlying eye conditions, it can be easy to dismiss a single episode as unrelated to circulation. However, when vision changes happen suddenly, especially in only one eye, or when they occur alongside dizziness, confusion, or weakness, they may be associated with reduced blood flow reaching the areas of the brain responsible for processing visual information. Patients sometimes describe this experience in vivid detail years later, precisely because it was so unsettling in the moment. One retired nurse recalled sitting at her kitchen table when the right half of her vision seemed to dim for close to a minute, as though someone had lowered a shade halfway down a window. It passed on its own, and because she felt fine afterward, she waited nearly a week before mentioning it to her physician. In hindsight, she wished she had sought care immediately, since sudden vision changes are considered one of the more time-sensitive warning signs. Any sudden change in vision, particularly one that appears without explanation, should be treated as a signal to seek prompt medical evaluation. Even if the vision returns to normal within minutes, it may be helpful to have the episode assessed by a healthcare professional as soon as possible, since early evaluation can play an important role in identifying the underlying cause. It can also be helpful to distinguish this kind of vision change from the visual disturbances that sometimes accompany migraines, such as shimmering lines or zigzag patterns that build gradually over several minutes. While both experiences can be unsettling, migraine-related visual changes tend to develop slowly and are often followed by a headache, whereas the vision changes associated with reduced blood flow tend to appear abruptly, with little or no warning. Paying attention to how quickly a change in vision begins can offer a useful clue, though only a healthcare professional can determine the actual cause. Number 5. Slurred or difficult speech. Speech is one of the most complex functions the brain performs, requiring coordination between multiple regions responsible for language, muscle control, and breathing. When blood flow to these areas becomes disrupted, even briefly, speech can become slurred, slowed, or difficult to produce. Some people find that their words come out mumbled, as though their mouth is not cooperating with their thoughts. Others may struggle to find the right words altogether, even when they know exactly what they want to say. This sign is often noticed by the people around someone rather than by the individual experiencing it. A spouse might comment that a sentence sounded unusually slurred, or a friend might ask if everything is okay after noticing a pause or stumble in conversation that feels out of character. This is one of the reasons awareness matters, not just for recognizing the sign in ourselves, but for noticing it in the people we spend time with. Consider Dorothy, a 78-year-old grandmother who was on a phone call with her granddaughter when her words suddenly began to slur in the middle of a sentence. Her granddaughter, who happened to have recently learned about warning signs like this one, immediately asked her to repeat a simple phrase and noticed that Dorothy struggled to get the words out clearly. Trusting her instincts, she called emergency services right away. Stories like this highlight how valuable it can be for family members to understand these signs as well, not only for their own health, but for the people they love. If speech suddenly becomes slurred, garbled, or difficult to produce, this is considered one of the classic signs associated with a possible stroke and should be treated as a medical emergency. Calling 911 immediately gives medical professionals the best opportunity to evaluate and respond quickly, since prompt treatment can make a meaningful difference in outcomes. It is worth noting that difficulty with speech does not always look the same from person to person. For some, it shows up as slurring, where words blend together in a way that sounds similar to being extremely tired. For others, it appears as a struggle to produce words at all, even though they know exactly what they want to say, a frustrating disconnect between thought and speech. Both versions of this sign deserve the same level of urgency, and neither should be waited out in hopes that it resolves on its own. Number 6. Persistent or unusual headaches. Headaches are common, and most of them have nothing to do with circulation to the brain. Stress, dehydration, poor sleep, and screen time can all contribute to the occasional headache that resolves with rest or over-the-counter relief. However, when a headache feels distinctly different from the ones a person usually experiences, or when it appears suddenly and reaches a severe intensity within a short period of time, it may be worth paying closer attention to. Some people describe this type of headache as feeling like the worst one they have ever had, arriving quickly and settling in a way that feels unfamiliar compared to their usual pattern. Others notice that the headache is accompanied by neck stiffness, sensitivity to light, or a pressure sensation that feels different from typical tension or migraine headaches. It is this sense of unfamiliarity, of the headache simply not feeling like the others, that often stands out most to those who experience it. It is worth noting that headaches associated with reduced blood flow are not always dramatic. In some cases, individuals notice a mild but persistent headache that lingers for days rather than hours, sometimes alongside a subtle sense of pressure or fullness that does not fully go away with rest. This kind of gradual, ongoing headache pattern may be easy to overlook, particularly for people who are used to living with occasional headaches already. If a headache is sudden, severe, and unlike any you have experienced before, it may be associated with a serious underlying issue and should be evaluated urgently, ideally through emergency care. For headaches that are persistent, unusual, or accompanied by other signs discussed in this video, scheduling an appointment with a healthcare provider can help determine whether further evaluation is needed. Keeping a simple record of headache patterns can be surprisingly useful during a medical visit. Noting when the headache started, how long it lasted, where the pain was located, and whether anything seemed to trigger it can help a healthcare provider distinguish between a routine headache and one that may warrant closer investigation. This kind of detail is often more valuable than people expect, since headaches can vary so widely from one individual to the next. Number 7, fatigue and difficulty with memory or word finding. This final sign is one that many people live with quietly for a long time, often without ever connecting it to circulation at all. It tends to develop gradually, which makes it easy to attribute to normal aging, a busy schedule, or simply getting older. But because the brain depends so heavily on consistent blood flow to support memory, focus, and word retrieval, a slow decline in circulation can sometimes show up first as a persistent, unexplained tiredness paired with small lapses in memory or language. People experiencing this sign often describe a specific and somewhat frustrating pattern. They find themselves needing more time to recall a familiar name, or they pause mid-sentence searching for a word that used to come easily. Alongside this, there is often a noticeable drop in mental stamina, a feeling of needing to rest after tasks that once felt effortless, such as reading for an extended period or following a detailed conversation. This combination of tiredness and subtle memory changes tends to build slowly, which is part of what makes it so easy to overlook. Robert, a 69-year-old retired accountant, began noticing that he needed to reread paragraphs in the newspaper that he used to understand on the first pass. He also found himself feeling unusually drained by early afternoon, despite sleeping a full night. For nearly a year, he assumed this was simply what getting older felt like. It was only after mentioning it during a routine checkup that his doctor suggested looking more closely at his cardiovascular health and how it might be connected to blood flow reaching his brain. His experience reflects something many people go through quietly, often for far longer than necessary, simply because these changes feel too gradual to raise concern. While memory changes and fatigue can result from many different factors, including sleep quality, stress, and normal aging, a persistent combination of both may be associated with reduced circulation to the brain over time. If you notice this pattern building gradually, it may be helpful to discuss it with a healthcare professional who can help determine whether further evaluation would be beneficial. What makes this sign particularly worth understanding is how much it can affect quality of life, even when nothing about it feels urgent. Unlike the other signs discussed in this video, there is rarely a single dramatic moment that prompts someone to seek help. Instead, it is often a loved one who finally says something, or a person who simply reaches a point where the tiredness and the small memory lapses feel too persistent to ignore any longer. Recognizing this pattern early, rather than waiting for it to become more pronounced, can make a meaningful difference in how it is addressed. Bringing everything together, these 7 signs, frequent dizziness, sudden confusion, one-sided numbness or weakness, sudden vision changes, slurred speech, unusual headaches, and the combination of fatigue with memory changes, all share one common thread. Each of them can be connected to how well blood is reaching the brain, and each one is often dismissed, minimized, or explained away as something ordinary. One of the most important points to remember from everything we have covered is that sudden symptoms, especially numbness, vision loss, or slurred speech, are considered signs that may indicate a stroke, and stroke is recognized as a leading cause of long-term disability. Recognizing these signs quickly and seeking prompt medical attention can play a meaningful role in outcomes, which is exactly why understanding them matters. If anything in this video felt familiar, whether it was something you have experienced yourself or something you have noticed in someone close to you, we would genuinely like to hear about it. What sign surprised you the most? And have you ever brushed off a symptom that you now realize might have deserved more attention? Sharing your thoughts in the comments not only helps start an important conversation, it may also help someone else recognize a sign in their own life before it becomes something more serious. If you found this information valuable, consider sharing it with a friend or family member who might benefit from knowing these signs as well. And if you would like to see more educational content like this, subscribing helps us continue creating videos that matter. Understanding these 7 signs is not about creating fear over every dizzy spell or every moment of forgetfulness. Most of the time, these experiences have simple, harmless explanations. What matters is paying attention to patterns, noticing when something feels genuinely different from your normal baseline, and being willing to bring those observations to a healthcare professional rather than quietly setting them aside. That single habit of noticing and speaking up is often what makes the biggest difference in the long run. Thank you for watching and take care of that remarkable brain of yours.